I think it's important to have primary care physician because I think it's fairly easy to get sidetracked when a person has a lot of medical conditions and they're seeing specific specialists for each one of those. Sometimes it can be lost in the details, the overall management care goals of the patient. It's also important to have someone who can effectively integrate, help coordinate some of that care between different specialists and answer some of the questions that they might have that specialists may not have time to be able to answer. The other reason it's important to have a primary care physician is that it helps consolidate some of your medical history and your records with one individual who's ultimately familiar with the complete history of each individual. Most often I feel like it's my job to serve as a coach. Effectively, what I want to do is give them advice and guidance for sound decisions that they can make regarding their health. Ultimately, they may require some additional assistance, and that's also my responsibility to be able to recognize those needs and find them an appropriate person to help address them. I think there's probably a lot of factors that can play a role in deciding who should be your primary care physician. Some individuals will feel more comfortable with a male or female. Others will want a younger physician. Others will want someone who's got more clinical experience. Ultimately, for me, what I've gotten from patient feedback is personality. Some individuals are looking for someone that they can hold a conversation with. Other people are looking for a very straightforward answer without a lot of explanation. And whichever patient is more comfortable with, I think that's ultimately who they need to choose. Whenever possible, I try not to refer only in the sense if I feel that a condition or problem is going to be out of my reach to be able to appropriately manage and make sure that they stay healthy, that their goals are reached, then I will try to keep the patient under my own care. But there's absolutely instances where a patient needs to be seen by a specialist. And what I again look for is some of those same roles that they may choose a primary care physician. The personality to match, availability is always a consideration when deciding who they should refer to. I guess I also consider personal references, or if I've ever worked with that individual. Most often individuals that I've worked with in the past or I've gotten to know either through hospital work or just outside of work that are other physicians, I usually feel fairly comfortable referring to them as well. My opinion is the best relationship between a patient and a physician is one where they feel comfortable asking me anything, regardless of how trivial they may perceive it, or the last thing I want them to consider is that it's a burden on me or that I feel put out to be asked multiple questions, things like that. I think it's important to have a relationship with the hospital because ultimately a majority of patients are going to need some form of specialized care. They may need to visit an emergency room or even be admitted into the hospital. And if that's the case, I want the treating physicians who are at the hospital to feel comfortable enough to ask me specific questions about the patient and vice versa. If a patient's being discharged, I would like to know specifically what the condition was, what they were seen for, how the hospital course went. And I think that a better relationship between outside primary care providers along with the people who, the acting hospitalists or surgeons here in the hospital ultimately leads to better care.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.